we're in the right place. Okay.
Oh yeah!
Usually when anybody mentions osteoporosis, the first thing that we think about is that it's a calcium deficiency, weak bones, or that we need to supplement with more calcium. And what I'd like to do with this video today is to share with you some of the common myths that are out there, especially this one about that you need to supplement with more calcium. Some researchers actually have shown where more calcium supplementation leads to more osteoporosis, which is very counterintuitive about what we would think with osteoporosis and calcium in our bones. Another common myth is that this only affects women. And it is more common in women, but you know, guys, we're not spared by this. So we have to take caution too with it. Another thing that we often hear about is it's only a disease of the elderly. But what we're seeing with every decade, that it's happening at younger and younger ages. The other thing that we oftentimes find is I'll hear patients say, well, I don't have any, you know, I've been told I have osteoporosis, and is that why I'm having pain in my back? And osteoporosis does not cause pain until you've had a fracture. And what's really startling, you know, that we're always told that if you want to prevent osteoporosis, or you have it and you want to stop the progression of it, to take calcium supplements. And you know, if this truly worked, we would see that osteoporosis would be becoming less and less prevalent. And actually, as you can see on the graph here, that it's becoming more and more prevalent and is expected to become more prevalent over the next couple of decades. So this is definitely a serious concern here. And you know, what I'd like to talk about are some of the statistics that we see with osteoporosis. Half of all women that go over the age of 50 will have a fracture. A third of all hip fractures experienced in our country here are with men with hip fractures. And a third of these men will be dead within a year of that hip fracture. The last statistic's very startling, that 1 out of 5 people that have a hip fracture from osteoporosis or weak bones will be dead within a year. So again, this is a very common or a very big reason why I would call this another silent killer, because you won't know it until you actually have a fracture, if you're waiting for the symptoms to show up. So when we look at bones, I just want to spend a brief moment here on, you know, what the function of our bones is. Number one, they provide our structure and support. They build your frame for you, so to speak. They protect your organs like your heart and your lungs and your spinal cord and your brain. They also produce many different blood cells, like your white blood cells and red blood cells and platelets. So very important there. And the other thing that we don't think about a lot of times is that your bones are like a bank. They're a storage bank of minerals. And just like if you're making more withdrawals from your bank account or bone account than you're making deposits, you're going to run into trouble. So some of the different risk factors that we know that will promote osteoporosis, number one, are nutritional deficiencies. Many people eat a lot of processed foods that don't have the nutrients in them to nurture and build up our bones. We're also told to stay out of the sun, or if you're out in the sun, make sure you put some sunscreen on before you ever get out there. And that's just one of the worst pieces of advice. You should get at least 15 minutes of sun exposure a day without sunscreen on. And this helps to boost those vitamin D levels, which help to build bone strength. Another common issue that we see are hormone imbalances, especially as women get into menopause, these estrogen imbalances. And another common thing is that with men, especially that are overweight, will start to become estrogen dominant. And this can create more problems too. Another thing we commonly see is that a lot of us have sedentary lifestyles, whether it's at work or at home. This is more of an issue and definitely promotes a weakening of our bones or osteoporosis. And then the last thing I want to mention as a risk factor, a lot of the medications that we take. There's several I want to mention. Aromatase inhibitors. These are oftentimes given to women after they've had breast cancer. SSRIs for depression. These can promote bone loss and osteoporosis. Proton pump inhibitors, which are used for acid reflux or GERD, over long-term use will cause osteoporosis, along with antacids, and also commonly known as steroids. Long-term use of these are very detrimental on bone health. So one of the other interesting things about medications is that the medications that are actually given to strengthen your bones, long-term use, and when we're talking about that, more than 5 years, will actually triple the risk that you have of having a hip fracture versus if you didn't take the bone strengthening medications. And that's because it makes your bones, it does build bone density, but it makes them more brittle. And you're 3 times likely to have a fracture if you're on these for more than 5 years. So what I'd like to share with you are 7 tips that you can use to help either reverse, stop, or prevent osteoporosis. The first tip is to optimize your vitamin D levels. And as I'd mentioned, you want to make sure you're getting out, getting at least 15 minutes of sun without sunscreen on a day. And obviously you don't want to get burnt. That is not good for the skin. But you do want to get out for at least 15 minutes. Secondly, and this is what we're really learning about, one of the hidden factors with creating good bone health is optimizing your vitamin K levels. And vitamin K is we're starting to learn more about it, how important it is in building bone health. What we know is that you can get vitamin K in your green leafy vegetables, egg yolks, butter, beef liver, fermented soy products like natto, very rich in vitamin K. What we know also is that many people, just like with vitamin D, the majority of our population is actually deficient in these 2 vitamins. And this could be a big part of why we're seeing osteoporosis on the rise. Next, what we want to do, the third step, is to optimize your vitamin C levels. And the reason for this is that vitamin C and vitamin K are important in building the bone matrix, which this is what all the minerals attach to. And it's very interesting to see with vitamin C, it's necessary to make collagen, which is like 90% of the bone proteins or bone matrix. And when you look at bones, if you were to remove the minerals out of bones, as you see in the picture here, they turn like to rubber. Whereas if you remove the collagen from bone, they become brittle. And this is the type of thing that we see with a hip fracture. So I would have to say that it's probably more important that we're getting healthy vitamin C and vitamin K to build that collagen in your bones to make them nice and strong. The fourth thing I'd like to talk about is optimizing your omega-3 levels. These are most predominantly fish oils, but also you can get it through some of your raw nuts like walnuts. Most people don't get enough in their diet, so you'll want to get these omega-3 essential fatty acids with a supplement, and a good high quality supplement. The fifth on the list that we want to talk about is avoiding processed foods. And just like what we'd mentioned with your bones are basically a bank account, whenever you eat processed foods, they tend to make more withdrawals and not make any deposits into your bones. So it's very important that we stay away from processed foods if you want to keep strong, healthy bones. Number 6 on the list is that you make sure you're getting plenty of high-quality proteins in your diet. You know, the 2 at the top of the list as far as that provide us with the nutrients and the amino acids that we need are whey protein. And again, you want to make sure it's a good quality whey protein. There's a lot of junk out on the market there. So you want to make sure it's a high quality. And also eggs are a wonderful source of protein. And the 7th tip that I want to share with you, and most of us know this with bone health, is that you have to be out there exercising regularly. You want to make sure that you're doing some weight-bearing exercises. This will also build the bone strength up. So I definitely thank you for tuning in, and I hope that you find this information useful. And also I want to see that you're starting to implement these tips today so that you can make sure you have the best, strongest bones possible.